I'm going to show you how to do the FABER test, also called Patrick's test, to assess for hip joint restriction. This test is performed with your patient lying supine on the couch. Ask your patient to cross the test leg over the contralateral leg so that the knee is flexed and the foot is over the thigh. Place your hand on the patient's anterior superior iliac spine, and with your other hand push the knee slowly into the couch with moderate pressure. This test is positive if the test leg remains above the contralateral leg. If this test is positive, it can be an indication of restriction in the hip joint, the sacroiliac joint, or contracture in the iliopsoas muscle on the affected side. This is called the FABER test because the test leg is flexed, abducted and externally rotated. So in summary, the FABER test is really great for looking at range of motion, especially in the hip joint, but in the hip flexors, sacroiliac joint and lumbar spine to a lesser degree. But as a pain provocation test in those four areas, it's really useful. So if ever you've seen somebody with hip joint pain or some level of arthritis in the hip joint and you look at their gait, the body has an amazing way of finding the path of least resistance, and they can walk in some fashion or another and actually look as though they're in less pain than they are. But when you do the FABER test and they're lying supine on the couch, if they have arthritis or pain in the hip joint, they may not be able to communicate to you in a way that you'll see on the couch because the leg just won't abduct or externally rotate, and it will elicit some really sharp pain. And you think, right, maybe this does warrant a orthopaedic assessment with the potential to have surgery. So it's a really great test for you as a practitioner to say, this is worse than they are communicating with me. There is a fair bit of research around the FABER test, but just a couple of papers. Broadhurst and Bond, when they were using the FABER test as one of 3 pain provocation tests, found a specificity of 100% and a sensitivity of 77 to 87%, which makes it quite a useful test. In another research paper by Martin and Celia, using kappa coefficients and 95% confidence intervals, found a kappa of 0.63 and a 95% confidence interval at 0.43 to 0.83, which kind of gives us reasonable agreement amongst raters. Thank you for watching, and don't forget to like the video. If you're not already subscribed, please subscribe for more biomechanics information from the Academy.